Good morning.
Good morning.
Good morning.
Good morning.
Thank you all for being here. And I wasn't sure whether I'm supposed to speak for 5 minutes or 50. That's what I was asking Tracy. So I'll just start and keep going. And I'll just talk for a few minutes. But I do need to know, have you had other members who are sponsoring medicinal marijuana-related legislation today or no?
No, not yet. You're the first.
They are coming, though, to speak, or they're not?
Not to my knowledge. We invited them, but we didn't hear back.
Well, that's rude. Are we taping this?
No.
Okay, that's fine.
Still.
So, there's a handout going around which I call the quintessential one-pager. And it's what I give to members of the Public Health Committee. It's what I give to members in the House chamber. I sit down with them, I try to explain what my legislation does, and then I give this to them and I say, would you look this over? It explains my legislation, and the most important item that you need to know, especially for this session, is that House Bill 837 does not legalize anything. Okay? I've been in the legislature for a long time. Some people say too long. And I've introduced the Affirmative Defense legislation for, I think, 6 sessions. 2 prior chairs of the Public Health Committee, on which I served, would not give the bill a hearing for 3 sessions. We did have a hearing last session, and some stars were born. Vince Lopez, and some of you may also have come and testified. But let me explain the bill for those of you who aren't familiar, or are you all familiar with the legislation?
Give a brief rundown.
Okay.
Thank you.
So, affirmative defense, and people don't really know what that means. Let me just preface it by saying there have been other bills that deal with medicinal marijuana introduced this session. Stephanie Click has a bill that basically would authorize or legalize the use of CBD, which is part of the plant, but it's very narrowly drawn, very narrowly drawn. It helps a population that needs help, just like many of you need help, but this is limited to kids with intractable epilepsy, and is modeled after legislation in a couple of other states. And there are all these hurdles that have to be overcome before you're even eligible to be considered for this. But it does legalize that part of the marijuana plant, and you can smoke it. It has to be ingested or rubbed on, and it's very, very narrowly drawn, and it would help that particular population. And why it's not a lot broader, I can't answer that. There is a full-blown medical marijuana legalization bill that was introduced right at the filing deadline last Friday, and that's Marisa Marquez's bill, and that's modeled after Colorado and a couple of other states, and that would legalize marijuana for medicinal purposes in Texas. There's also a full-blown legalization bill that a member named David Simpson has introduced, and that's to legalize marijuana for recreational use, which of course would include medicinal purposes, because it's legalizing marijuana. And in my humble opinion, that bill has no chance. I'm very skeptical about a full-blown medicinal marijuana legalization bill. The leadership, meaning Dan Patrick, the governor, and some others, said as soon as those bills were filed, those bills are going nowhere. And that's why it's important to understand that the legislation that I've introduced does not legalize anything. It's a big difference. So, how does this bill work? Maybe you've had a chance to look at that. But here's how it works. So you have an individual with a bona fide medical condition, AIDS, cancer, multiple sclerosis, cerebral palsy, pain associated with glaucoma, neurological disorders, including, of course, epilepsy, muscle spasms. So it's got to be a bona fide medical condition. And who decides what that is? Your doctor. Your doctor knows what a legitimate bona fide medical condition is. So let's say you have multiple sclerosis, and you're confined to a wheelchair, and you're living with some chronic and debilitating pain. You're visiting with your doctor, and he says, well, we've tried everything to address the pain that's associated with the symptoms of multiple sclerosis, and nothing's really working. And then the doctor says, we've tried everything. I know some docs who have suggested or recommended that patients like you try marijuana for medicinal purposes. Now, I think you all know that 23 states have legalized marijuana for medicinal purposes, and doctors talk to each other. In Texas, a doctor could at best recommend or suggest that you try it. Can't prescribe it because it's illegal. So the doctor says to this woman, I'm going to suggest that you try it. I'm going to recommend that you try it. I know doctors who have legally prescribed it. I know doctors who have suggested or recommended. And in certain situations, one could argue many situations, it really helps. So, this woman with multiple sclerosis in a wheelchair decides to try it. And guess what? It really helps her address the debilitating and chronic pain associated with her bona fide medical condition. So she's doing that. And it enables her to live without the pain. It enables her to work because she doesn't have the pain. And she's in her house, at her desk, working or sitting in her living room. And law enforcement comes in and arrests her for illegal possession of marijuana. So here's where the affirmative defense comes in. This bill allows that individual to go before a judge and to say, Your Honor, look at me, I'm not a criminal. I smoke marijuana because my doctor suggested it or recommended it. It really helps me. It helps me live without the pain. Without the pain, I'm able to work. My doctor recommended it. And the judge would be authorized, wouldn't have to, but the judge, per my bill, would have the discretion to look at this individual and say, you're obviously not a criminal. Your doctor suggested this. You're doing it. You are breaking the law, but it's helping you. It's not hurting anyone. I'm going to dismiss the charges and tell you to go home, and good luck to you. That's how it works. So what it does is that it doesn't legalize anything, but it gives the judge the power, the authority to look at an individual case and to say, there's no reason on earth. Who knows what the penalty is? I think it's up to 180 days in jail.
And a $2,000 fine.
Up to a $2,000.
And a criminal record for the rest of your life.
Yeah, absolutely, absolutely. And this is for a person who's following her doctor's suggestion, has a bona fide medical condition that's helping her. That's what she can be subject to, and that's insane. That's insane. So I've had some discussions with some members, and they've said, well, what about if a person is driving a car and gets pulled over and has a pound of marijuana in the trunk and says to the police officer, hey man, I got a stuffed nose, or says I'm following my doctor's orders. Well, obviously, when an individual like that gets before a judge and says, hey man, I have a stuffed nose or an earache, and you had a pound of marijuana, yeah, why not? The judge would say, in his or her discretion, are you kidding me? Proceed with the prosecution. So it's up to the judge, and it's also up to the physician as to whether or not he will suggest it. So one member said, well, won't the doctors get in trouble if they suggest an illegal substance? And I said, we put protections in the bill. So a doctor who suggests or recommends it won't be violating the Hippocratic Oath. And we also put in protections for caregivers. That's the bill, and I spend time with the chair explaining the bill and that it doesn't legalize anything. And we're hoping to get a hearing again. And this bill doesn't go far enough. Yes, you would end up with a criminal record, and you do have to deal with the courts. But if this bill passes, it sends such a strong message to law enforcement throughout the state that if you go into a house and you see somebody with AIDS or cancer and they're smoking a joint and they're clearly sick and they say, my doctor suggested I try this, it really helps me, leave them alone. Don't bust them, don't arrest them. That may be the most important byproduct of this legislation. That's what it's all about. Eventually, marijuana will be legalized for medicinal purposes. In Texas, it may take years. There's been some talk that a select committee will be established this session to look at all aspects of medicinal marijuana and come up with recommendations. I don't know if that will happen, but it wouldn't surprise me because there are several bills out there, and that would be an easy way for leadership to just put it off and put it off, and that's not what we need. So why don't I stop, because you may have some questions or some comments. Yes?
For instance, the way medical insurance is set up now, you're confined to a certain network of doctors, and you cannot get a doctor that wants to talk about medical cannabis. But you have a condition that is scientifically, with studies, proven that cannabis helps this condition, and you go in front of a judge and say, look, I'm using this for this reason, and here are the studies that confirm that cannabis helps for this condition. Will your bill in any way establish that as a reason for a judge to consider maybe dismissing the case? I mean, do you have to have a doctor's prescription?
It can't be a prescription.
Or, well, not a prescription, but a doctor's note or a doctor's whatever, permission written in the chart. What if you can't get that? What if you can't get a doctor? I've had doctors that said, I don't even want to talk about it.
Okay.
So what happens then? 'Cause a lot of doctors don't want to talk. A lot of our legislators don't even want to talk about it.
And that would be a problem. I think somebody with a bona fide medical condition could probably find a doctor who would say, why don't you try it? But
the problem is with the Obamacare now, I have one doctor I can see.
Mm-hmm.
And that's it. I can't see unless he recommends me to someone else. And when he doesn't know anything about my condition, I have Lyme disease, and there aren't enough doctors here in Texas that understand about Lyme disease, and I represent a large group of Lyme patients that suffer from pain.
I
excruciating pain.
I know about Lyme
And
disease.
the problem is that we don't have the medical opportunities to go and see another doctor because we're entrapped in Obamacare.
I understand. I understand. I'm saying that this is the most conservative bill that you can imagine, and there are many problems with it. But I have felt for years that it's a very positive step in the right direction, and that the most important intended consequence of this bill is sending a message to law enforcement: don't mess with people who are sick. And so, of course, there are problems. But if that message gets out, they won't mess with you. Or they'll come in and go, oh, well, this person's sick. And remember that the federal government, the Department of Justice, has been directed by Congress now to not get involved in implementation issues of medicinal marijuana laws in any state which has either legalized or authorized the use. So the feds are saying, we're backing off. These messages are all really important. And I think that if this bill passes, it will help those of you who may not be able to get your doctor or a doctor to sign a letter. But if you get busted, hopefully you won't, and if you go before a judge, I don't think there'd be a problem if you have a bona fide medical condition telling the judge, my doctor suggested it. Would the judge then say, I need proof? I mean, if you're there with a bona fide medical condition, you say, my doctor suggested it and it really helps, the judge will make that determination. It doesn't say that you have to have a signed letter. It doesn't say that the doctor has to come and testify. It says that the doctor has to have suggested it or recommended its use. Yes?
I was just going to say, I think we have to remember that HB 837 is kind of like a safety net for the patients. It doesn't set up a comprehensive medical program, but it does provide a protection for patients. And if you're having an issue with the discussion with your doctor, you could potentially print out the bill and show them that there is a protection for them if they'd like to discuss it with you. So I think that it's important that we realize that this is strategy, just like you're talking about, Representative. This is our foot in to get a more comprehensive bill down the line.
Exactly.
And if doctors aren't risking their license or disciplinary action, and that's what this bill does, then they're gonna have the conversation with you. Most of them, don't want to, but just out of fear of getting turned in.
That's right. Yes?
And I think just to clarify one part of it, so this would mean that if a judge believes you have the recommendation, you have a bona fide condition, you would end up without a conviction. It would be dismissed? Is that how it would work?
Absolutely.
Right.
The charges would be dismissed. Yes.
Now, will that help protect you under concentrates also?
Under what?
Concentrates, oils,
It just
waxes.
says marijuana.
That would fall under marijuana to me.
Yeah.
Well, we're talking
To
about,
our representatives, it might not.
we're talking about,
It's a felony now to possess any amount. And some patients do need to take this,
That way they don't
for
smoke.
cancer,
Yeah.
so they don't have to smoke
Well,
it.
any oral or topical is considered a concentrate at this point, so if I were to have topical balm, rub it on me where I have arthritis, that's a felony.
Yeah.
I understand. So if you get busted, it doesn't say what form
Right.
the cannabis
There you
takes.
go.
It's going to be up to your doc, and it's going to be up to the judge. That's
Thank you.
way in the back.
Yes, I am blessed to have an amazing neurologist, and he works with me every day trying to help with my prescriptions and the reactions I'm having. Every time cannabis comes up, he automatically says, wait a minute, we can't even study that in Texas. So until our Texas neurologist can do studies on them, how am I supposed to recommend something to you that I'm only reading about in media articles? So he is all for Texas opening up and helping with these studies, but Like he said, if I want to try it, I need to go to a legal state. So we're actually working to get me to go to Oregon to try it for 30 days just to bring it back, because it is illegal for this man to do any kind of studies in Texas. So how do you expect our doctors to recommend something that they can't even study on, is my question.
I don't understand why you're saying it's illegal to do a study.
They don't do any research.
They can't do
research.
She's talking about an individual patient research study as opposed to other studies that you're seeing in other states. So she's talking about her participating in a study. Let's all try to talk one at a time and respect the representative's time. But I think that what she's speaking about is being a part of a patient research program in Texas, and that he can't do a research in Texas, is what she's pertaining to.
Okay, well, if that's the case, then we have one of many, many problems with my very conservative bill, which is only intended to help people who can go before a judge and say, I have a bona fide medical condition, my doctor suggested it, I'm not a criminal, and the judge would be able to say, charges dismissed, go home, be careful. That's all this bill does. I'm not pretending that it does more. It fills a little gap until we get medicinal marijuana legalized in Texas. Yes.
So I'm on a different spectrum than some of the people who've been speaking. My doctors actually totally are for it. I've spoken to a lot of my medical
Totally
professionals.
what?
They're totally for using cannabis for a condition such as my own, which is cancer.
Yeah.
And so I have actually been working on obtaining letters from my doctors. So this isn't really a question, it's more of, I wanted to thank you very much for taking the step to introduce this bill.
You're very welcome.
Yes, absolutely.
Okay, let's take a couple more because my 50 minutes are almost up. Yes.
Okay, my problem is I work for the city of Corpus Christi, and there's nothing to protect me from my employer firing me. I've been there 8 years now, and I've been tested at least 5 times for marijuana, well, drugs in general. See, we need something like that to cover us too, because...
Well, you're talking about expanding law, amending existing laws,
Yeah.
and this bill has nothing to do with legalizing any. This is a very simple conservative
Right,
bill.
but even in the way it's written, you know, I still can't use it. I can't use cannabis at all.
It's true.
And I have epilepsy. I've already had 2 pieces of the brain cut out. And that was due to damage caused by a generic version of Dilantin.
Well, I wish that I thought that a medicinal marijuana legalization bill had a snowball's chance. I hope I'm wrong, but I think it doesn't. And so I'm trying to help people who can take advantage of what this bill authorizes. And that's all I can do with this bill.
It would be nice to have some clause where it also cancels out.
Well, that's what the